Driving under the influence of prescription and OTC drugs, Part 2. Opioid prescriptions and your ability to drive. Opioids are known to make people sleepy and impair their capacity to reason. The data we do have suggests that driving while under the influence of any opioid can double the risk of being in an accident, despite the fact that there have been very few research specifically investigating the effects of opioid painkillers on driving abilities. Opioid painkillers can cause impairment even at relatively modest dosages, however, this varies from person to person. Although the biological causes and medicinal uses of all opioid medications vary significantly, the effects on impairment are generally similar and will probably include drowsiness, mental confusion, and impaired coordination. These negative impacts might have disastrous results while operating a vehicle. Opioid usage impairs one's ability to focus on the road, making it more likely that they may miss crucial visual cues like traffic signals, other drivers, and imminent changes to the road structure. Additionally, they could struggle to stay awake and have microsleeps. Opioid intoxication's physical side effects make it easy to move carelessly. When provided with opportunities to slow down or stop, someone under the influence of an opioid will have a slower overall reaction time and might not apply the brakes in time. They could turn excessively wildly or veer off the road due to poor steering control. Depressants for the central nervous system. For sleep difficulties, anxiety, panic attacks, seizures, restless leg syndrome, and a number of other diseases, doctors frequently prescribe depressants including barbiturates, benzodiazepines, and Z-drugs, non-benzodiazepines having comparable effects. Due to the fact that many of these medicines can lead to physical dependence and psychological addiction, they are carefully regulated and only available with a prescription. When used improperly or in combination with alcohol, some medications have a substantial risk of overdosing. Benzodiazepines. One of the pharmacological classes that is most frequently prescribed in the U.S. is the benzodiazepine family. In addition, they are among the most often abused. 30.6 million adults in the United States took benzodiazepines between 2015 and 2016, according to data from the National Survey on Drug Use and Health. Only 25.3 million of those people had valid prescriptions for the medication, and 5.3 million misused it after obtaining it illegally. These benzodiazepines are some of the most popular ones. Common benzodiazepines on prescription: alprazolam, Xanax, chlordiazepoxide, Librium, clorazepate, Transine, Estazolam, temazepam, Restoril, diazepam, Valium, Triazolam, Apotriazo, Halcione, Hypam or Trilam. Benzodiazepines are potent sedatives that may cause unpleasant side effects to manifest right away. Depending on tolerance, genetics, and other factors, different people will experience these adverse effects at different doses. They consist of drowsiness, confusion, dizziness, shaking, a lack of cooperation, distorted vision, extreme lassitude, headaches. Barbiturates. Barbiturates have effects that are comparable to those of benzodiazepines, although they are administered less commonly since it is believed that they are more likely to cause adverse effects, abuse, and overdose. The following is a list of some popular barbiturates. Frequently prescribed barbiturates: phenobarbital, seconal, butylbutyrbarbital. Barbiturates are infrequently given for anxiety and sleep disorders, in contrast to benzodiazepines. The treatment of epilepsy, seizures, head injuries, convulsions, and severe migraines is where they are most frequently utilized. Drowsiness and nausea are the negative effects of using barbiturates that occur most frequently. However, patients might also go through large muscles, ineffective coordination, bad headaches, confusion, loss of memory, slowed breathing. Z-drugs. Non-benzodiazepine depressants known as Z-drugs are frequently administered to treat sleep disturbances. Since all of their names either start with the letter Z or contain it, they are known as Z-drugs. The following is a list of some well-known pharmaceuticals in this class. Frequently prescribed Z-drugs: Zopiclone, Lunesta, Zaloplan, Sonata, Zolpidem, Ambien, Zopiclone. The majority of Z-drugs have a far stronger sedative effect than other CNS depressants but do not have the same anti-anxiety effects. These medications' adverse effects can include Headache, mouth ache, a lack of cooperation, faulty judgment, hallucinations, no memory, daytime slumber, confusion. Sleepwalking, sleep eating, and even sleep driving are examples of complex sleep behaviors.